All right. So, hello, everybody. My name is Tiffany Belculfine. I am a physician assistant, and I am the clinical coordinator for the Wellness Center for Bone and Joint Health at Magee. And the reason that bone and joint health is important, well, we're going to tell you why. So, it is important to everybody. It's definitely something we want to talk to all of you about and let you know why it's something we need to focus on. And I have been in this position for about 2 years now. And I see patients with various bone and joint health conditions, osteoporosis, osteoarthritis, people who are maybe thinking about having a surgery, but they're not quite there yet. So I help patients in all different capacities with lots of different bone health options. We make our programs very personalized for all of our patients so that everyone can get what they are looking for. And the biggest things to me are to hear about the things that matter the most to people. So we don't want to focus on what's the matter with you. We want to focus on what actually matters to you. Because we can talk about bone health till we're blue in the face, but if it doesn't actually align with your life, you're not going to be very interested in listening. So we do our best to make sure that we're including you in all of our conversations about bone health to make sure that you are getting what you need. So before I took this position, I have worked in several other medical fields, including about 7 years in breast oncology. So I was in the breast surgery program at Magee. And so this program really aligned really nicely with all of my years of doing that and then being able to share my current knowledge with all of you too. So I went to Geneva College for my undergrad. And then I went to PA school at Eastern Virginia Medical School. I am a Beaver County girl, and that's where I still live. So I'm so excited to meet everybody and connect with everybody and really share with you why we think your bone health is so important and why it matters to everybody. So we'll go ahead and we'll advance to the next slide, please.
I'm sorry. There we go.
Oh, good. Sorry, I forgot who was doing it at this point.
Just yell at me if you need me to go quicker.
Okay, no worries. So, when we talk about our bones, we want to realize how important those bones are for everything in our body. Not only do our bones give our body shape, but it also gives us support. And then in turn, our bones are supported by other parts of our body. So, our bones are supported by our muscles and our tendons, our ligaments. Everything works together to support those healthy bones and keep them where they need to be. It also helps protect our organs. So if we didn't have our bones in our body, our organs would just be floating around and causing all kinds of havoc. So we're happy that the bones are there. Our bones also allow us to move. If you have ever looked at your wrist, if you hold your wrist out in front of you and you turn it side to side, those are your bones that are making that do that for you. So every movement that our body makes comes as a result of those bones doing their normal function. Now, who needs to worry about their bone health? The answer is everybody. Every person of every age, every gender, every person has bones, first and foremost. But also, we all have different risk factors for our bone health and for our bone wellness. So, a lot of times when we talk about certain bone conditions, we think, oh, that's just a woman's problem. But in effect, those things can actually affect men too. Maybe not as much, but they definitely still can be included in paying attention to those risks. Osteoarthritis, osteoporosis, both of those can affect men. We'll talk a little bit more about that in just a minute, but it's important to realize because a lot of times women are the ones being told, don't fall, you could fracture hip, don't fall, you don't want to do that. But men need to be aware that it's important for them too. Go ahead, Noelle. Thank you.
You're welcome.
So, when we talk about risk factors, every person on this planet has a different number of risk factors. It all depends who we are, what our family history is, what our current health status is. Nobody ever has just one thing, unfortunately. So even if someone is super healthy, they may have some family issues that could be a factor in their bone and joint health. So every risk factor that we have, some of them we can control and some of them we can't. So we can't go back and undo if our mom had bone problems like osteoporosis, or if she had a stooped posture, or if she had lots of falls and fractures, or if our Aunt Susie had that, or if our grandma had that. We can't go back and undo that family history. We can't change how old we are. I'm sorry, we just can't. We can lie about it, but we can't actually change it and change the age of our bones. Gender, you were born female, you are still female. Even if people have changed things otherwise, their bones still tell the story of what they were born as. Our body weight, our body mass index. So a low body mass index, or BMI, can be just as risky as a high BMI. A low BMI is usually people who are very petite, people who have a smaller body structure. Those people are at risk for having more problems with their bones compared to people who have a higher BMI. But people with a very high BMI are unfortunately putting a lot of extra pressure and bad stress on their bones and on their joints. So, for each pound of weight that we are overweight, our body is actually experiencing 5 to 6 pounds of stress on our bones. So, if we are 10 pounds overweight, that is 50 to 60 pounds of extra stress on our bones. So, you can see that a high BMI can be just as risky for people as a low BMI. Those are the things that, we want to pay attention to first and foremost. The first three of those are the ones that we can't do anything about. Another one we can't go back and do anything about is if we've taken medicines in the past. So if we've had certain medicines that we had to take for certain health conditions that may affect our bones, we can't go back and undo that. Maybe we don't need to take those medicines in the future, but if we already took them, that's part of our risk factors for what we're dealing with. Unfortunately, things like various cancer medicines, chemotherapy, radiation, all of those can be factors that we can't go back and undo either. Now, the ones we can do something about, if our BMI is not healthy, we can change that. If we're not getting enough exercise movement and we're not logging our minutes like Jen just told us to do, then that's something we can change and we can improve. And every single little bit that we do to reduce these risk factors ends up helping us in the long run. Smoking or vaping, if that is a risky substance that is part of your life, starting to reduce that would be good for you for so many reasons. And also, stopping those substances would be great for you. Too much alcohol consumption, same thing. That can weaken our bones in lots of different ways. And then if we've had a history of falls or fractures, we can't go back and undo that, but we can be a little safer next time around so that we hopefully don't have that keep happening to us. So things we want to do to manage these risk factors, whether they're ones we can change or not change, we can always make sure we're letting our body get enough rest. We don't really appreciate how important rest is for our body to heal itself. And we all need that. Every creature on this planet needs rest, including all of us. So even if you say, I don't need that much sleep, you actually do. You really do. Other things, avoiding those risky substances, getting proper nutrition, making sure that you're supporting your body in the best ways that you can with what you put into it, getting that activity, getting that physical body movement, having your height measured. This is one that people don't think about. We go to the doctor once or twice a year, whatever we do, and every time we're there, they say, has anything changed? And we say no. And they say, are you 5'5"? And we say, yep. And we just move on about our day. But if no one has ever actually measured you recently, you might be 5'3" now and not know it. So you might have lost some of that height and not even realize that that has changed for you. And that's a factor in your bone health. And then other things would include getting a bone density scan, which we're going to talk about next. So as I mentioned, there are some cancer-specific agents that can affect people's bone health. Anyone who has ever been on or been connected to a person who has needed to use a medicine called an aromatase inhibitor. So these are your Femera, your Arimidex, those kinds of medicines. If anyone has been part of using those medications or certain other medications like long-term steroids, again, the chemotherapy drugs, radiation, all of those things can weaken our bones. It's challenging because your body needed whatever your body needed for what your risk factors were and to manage any illness that you had. But at the same time, nothing that we do is without other risks. And that's very hard. Even if we look at a bottle of Tylenol, there's a lot of risk factors on the back of a bottle of Tylenol, things that can happen if we take that medicine too much, too frequently. So all of those things can be a factor. Anyone who has ever been in affiliation with any of these medicines will probably understand what I'm saying. If you have not been exposed to that before, just hopefully you'll learn a little something today. Those medicines often cause joint pain, and they also cause symptoms of menopause. So even in men who may have to take some of these medications, they are feeling some different symptoms. And what that all comes down to is our hormones. So, our estrogen, female hormone, is connected to our bone and joint health. The reason this is important in some cancer cases is because if the cancers are hormone receptor positive, so if they were PR positive, those are the ones that were actually fed by female hormones. So, in order to block our female hormones, we have to take the medicines. And those medicines then stop any hormones we have left from doing their normal jobs for us. We don't really think about our hormones until we don't have them anymore. So we can have lots of things happen. If we think about when we would have had our cycles, sometimes during the week of our cycle, things are a little different for us. Maybe our back hurt, maybe we had a headache, maybe we, felt a little different or we were a little agitated. All of that comes from our hormones basically being out of whack during that time of our cycle. And then the rest of the month, everything is back in balance and everything is normal. We're basically looking at your hormones being out of whack all the time when you're on these medications because they're blocking your hormones so that any remaining cancer cell that may possibly be there does not have any access to those hormones. So when we're looking at that, we're losing estrogen as we age. So that affects our bones, makes our bones weaker. And then when we have something else on board, like one of these medications, that can even make the bone density less still. Now, tamoxifen in some cases is another alternative for people, and that may be something that is bone protective. If someone is postmenopausal, so they've already gone through their change of life, they may get some good benefit from tamoxifen. It's still not intended to be used to prevent osteoporosis, but it definitely can protect the bones a little bit more than some of the other categories of medicine can. Go ahead. Thank you so much. As I said, we would talk about what a DEXA scan is. So a DEXA scan is also called a bone mineral density test. And that is important because many times osteoporosis or the condition that comes before it, osteopenia, are very silent diseases. We don't know that those are happening until something happens. We don't know that we could have these risk factors and these problems with our bones until we either fall and break something unexpectedly, or we get a bone test and someone says, oh, hey, by the way, you have osteoporosis. You don't really have any warning of it happening. So it is a safe, painless measurement of your bone density. They check multiple sites in your body and they give you information about each site, where it falls on the category. So is it normal? Is it low bone density or osteopenia? Or is it really low bone density called osteoporosis? So a lot of times we don't get this test done until we're 65. If you are a woman or if you are a man and you are over the age of 65, you should have already had one of these done. If you haven't, for whatever reason, please talk to your provider about it to see if you can get that test done because you should. It's really important. Otherwise, there are some other groups of people that could get this test even sooner. So, women who are out of menopause can get a bone density test done. Absolutely, they can. Again, that hormone that we lose can affect our bones. So, we can usually get that test pushed through a little sooner. And then women and men who are between the age of 50 and 64 who have certain risk factors can also get a test done sooner. So if they've already had a fracture or they had somebody in their family with osteoporosis, or they're a smoker, or they have a low BMI, lots of different risk factors, they can get a bone density test sooner, and they should. Otherwise, women or men who are under the age and who have other risk factors, conditions associated with bone loss, long-term steroid use, chemotherapy, things like that, those folks can even get one done sooner too. Next slide. So when we look at this chart, this kind of ties everything together. Our bones are actually at their strongest when we're in our 30s, which is crazy. So, when we're in our 30s, we are not thinking about our bones. We tend to think, oh, that's a problem for many years from now. I don't have to worry about that yet. But knowing that our bones now are strongest when we're in our 30s and that we don't get a test until we're 65, that's 35 years of not knowing what's happening with our bones. Men are going to lose bone loss less at a rate than women do because of the hormone involvement. But women definitely have a lot of bone loss over the years that goes on as we enter menopause and things like that. You can see that the women line is a lot lower than the men line. So the men can still have problems, but the women really are more at risk for these things happening. So we want to find any way that we can get you a bone density test as soon as we can. If you haven't had one, we want to make sure you know what your risk factors are so that we can maybe bridge that gap a little bit and you don't have to wait 30 years to know what's happening. Next slide. And that's it for me.
Nice. Thank you, Tiffany. Jen, do you have to do anything to change it over? Or am I okay to start?
Oh, Jen's muted.
Sorry, I was muted. Hold on.
That's okay.
Yeah, I think we're good.
Good. All right, great. What Tiffany said again, thank you for having us. We're really honored to be here. My name's Noelle DiGioia Guthrie. I'm an orthopedic surgeon at the Bone and Joint Center at Magee-Womens Hospital. So Tiffany and I work really closely together to give you some perspective. So I'm at the Bone and Joint Center, which is kind of our operative side. So I specialize in total hip and knee replacements, so total joint replacements. I'm also the co-medical director of the Wellness Center, which Tiffany works at primarily. So we have a really good connection because, I'm more on the clinical operative side of doing, total joint replacements, but Tiffany and I work a lot together to, do a lot of education on bone and joint health, work with our patients. We, refer patients back to each other to help people with, a variety of different things kind of under the umbrella of bone and joint health. But so kind of to expound on some of the things that Tiffany was talking about, just going through a few things that are important for you guys in your daily life to how you can kind of prioritize your bone and joint health. And, very simple things, which you guys probably are already doing already. It sounds like, with your movement tracking and everything, you guys are steps ahead of us. So I know a lot of this you've probably heard already, but first of all, just thinking about that food is medicine, really. I know a lot of times we don't really think about it that way. I'm from a big Italian family, so food is just important in all ways of life. But if you really dig deeper, food can really affect your life. It can hurt or help your well-being. It affects your health. It can help manage and prevent diseases. And also it impacts community health. I think, food also is very social. I think it helps you, form community connections. And then below, deeper than that, it also forms healthy habits. So just, and you guys might know this already, I'm sure you do, but kind of just to go over a few specific foods that are higher in certain things that help improve bone density. You want to think about eating things that are higher in dietary fiber, calcium, vitamin D, iron, potassium, and we'll kind of go into more specifics in the next slide. And then obviously trying to lower intake in saturated fat, sodium, added sugars. And then just thinking about the biology of how your bones build. Calcium and vitamin D are really integral in the biology of how your bones turn over. So the more your body can absorb, has the access to calcium and vitamin D, the more you can have stronger, healthy bones. So just, calcium-rich diet includes dairies, kind of everyone knows that yogurts, fortified orange juice, squash, edamame is a good one. Canned sardines, I'm not a big fan, but some people are. Almonds too. So, and a lot of your leafy greens like kale, turnips, mustards, those are also really good in calcium as well. And also, your diet can really affect the inflammation in your body. This is one thing that a lot of people, I think it's been more popular lately, but you don't really think about on a daily basis. But there are a lot of really good good foods that actually are anti-inflammatory. So they can actually fight inflammation in your body. It's not just that they're neutral, but they actually help fight inflammation. So oily fish, tuna, salmon, blueberries are really good. Kale, like we said again, beans and legumes like lentils, nuts, olive oil, lots of fiber, and then some extra spices like ginger and turmeric are really good to eat. And then another, you know, in addition to as food being medicine, and this is, you guys definitely already know this, that movement is medicine. Movement is so important to daily life. Whether you're trying to strive to get those so many steps you need to get a day, or just how it makes your mental health feel better. I think there's we note everything here that it helps, it reduces stress, it improves your mood, it makes you, happier with the people you're around, it helps you control your weight, which makes you feel better. It prevents joint stiffness. A huge thing with joint health that I talk about like on a daily basis with my patients is, just biologically. So your joints like to move. You have a synovial lining in your joints that actually make fluid. And the more you move them, the more that fluid is made and circulates, which actually lubricates your joints. So a lot of patients with arthritis, the more you move, the better you feel. And that's a really big thing. And then the less you move, the stiffer you get and the more pain you have. So, movement from that side of my conversation with my patients is huge, but just in general, you can really tell, when you go out for a walk, even if it's 10, 15 minutes, whatnot, it just, kind of improves your mentality, improves how you feel for the rest of the day. And then a lot of people, excuse me, ask us, and me particularly on it, when I talk with patients, a lot of patients who have arthritis is, what kind of exercises are good for me to do? What should I do to, improve my bone and joint health, reduce pain in my joints? And I think, so there's a saying that we have in orthopedics that I really like. It's called use it or lose it. So basically using your bones, using your muscles, using, your body makes you build your bone health. So bone actually forms along lines of stress. So that's kind of where it comes from. So the more stress you put on your bones, the stronger your bones will be because they'll build more bone. So it's really, this slide kind of goes over weight bearing exercises, jumping rope, jumping jacks, jogging, hiking, stair climbing, tennis. And then, on the other side of things are some lower impact stuff, walking on a treadmill, elliptical, low impact aerobics, swimming is great. And, also to mention on the other side of things, as I do have a lot of patients with arthritis, sometimes high impact, like constant exercises, like running on a treadmill, like running long distances, though that's not good for your joints, but, you can do those things in moderation, which help build up your bone and prevent, fragility fractures down the line. And then I think a big thing, a lot of these things are just kind of getting you ready for life skills, just, things like going up and down stairs, rising from your chair. I think a lot of my patients I see are really surprised when it's hard for them to go from a sitting to standing position because of the weakness in their legs, oftentimes secondary to arthritis. So I think doing movement activities like you guys are doing, like we kind of are mentioning, it's really important to help you, doing things that you do on an everyday basis, getting up from the floor, maybe you slip outside in the snow, or you're on your floor or gardening or something like that. It just helps you to, get up more from a chair, do easy things that you take for granted. And then I think we, in the closing of the presentation, we really wanted to give you some resources that we like to share with our patients. The first one's kind of a little plug for Tiffany and I. So we started a podcast recently, probably like Tiff, like 3 months ago, maybe a little bit more. And we have one episode a month that's released. It's on all major platforms. We kind of go over, basic umbrella bone and joint health, osteoporosis, osteopenia, osteoarthritis, talking about surgery. So all different kinds of things. And, so that's a good resource. There's an online platform called MedBridge, which is a kind of a physical therapy website. You can be a member and actually, like personalized physical therapy programs for yourself. And I know, Jen, I had sent you a PDF that actually has one for directed at osteoporosis at the end, which is a good way to kind of get introduced to it. The next 2 points are our websites, which have really good resources as well, just to kind of jot through. And then Diane PT is another physical therapy website that's great. We have our own recipe book from the Wellness Center. That's really awesome. We've had a lot of patients who are like, I love that recipe. Like, I wish I had that sooner. And it actually marks, what's anti-inflammatory, what's high in calcium and vitamin D. So that's linked right there. And then the last few things are just some good websites as far as osteoporosis, and then an article about calcium rich foods. So we thought we'd show those to you guys. And then this is also just a sheet of, we have a lot of outreach events that we do with the Wellness Center, a lot. So this kind of goes through them. If you guys, I know we're kind of far and wide, but these are listed here. And I think, Jen, I send you a PDF of this, so you could send that to everybody. But that's it. Like I said, we're really glad to be here, and we're, welcome any questions, comments.